Acute cystitis is an acute inflammation of the bladder. Women are affected 10 times more than men due to the shortness of the urethra compared to that of men. So 40% to 50% of all women would develop cystitis in their lifetime. The ascending fecal perineal urethral route is a primary mode of infection. Occasionally, sexually transmitted organisms are involved. Risk factors include neutral catheterization and diabetes. Causes E. coli, as in about 80%, and Staphylococcus saprophyticus, and Klebsiella proteus mirabilis, um, Gonococcus and Enterococci. And the symptoms are low-grade fever, frequency nocturia, agency, dysuria, hematuria, cloudy and foul-smelling urine, and low back and suprapubic pain. So the signs that are usually elicited are low-grade fever, suprapubic tenderness, and hematuria. Investigations: urinalysis, midstream urine for culture and sensitivity, FBC, FBS, imaging of urinary tract in recurrent or persistent cases to exclude anatomical abnormalities, also lower urinary tract obstruction, and erythrocystoscopy in selected cases. The main treatment objectives are to eradicate infection, to prevent recurrence and complications, to relieve pain. Non-pharmacological treatment: liberal oral fluids to encourage good urinary output, and precoital and postcoital emptying of the bladder. Personal hygiene and proper cleaning after defecation, especially in females. Pharmacological treatments: acute uncomplicated cystitis, absence of fever and flank pain. First line treatment: to give nitrofurantoin oral 100 milligrams 6 hourly for 5 to 7 days. In children 12 to 18 years, to give 50 milligrams 6 hourly for 7 days. And for 3 months to 12 years, give 750 micrograms per kilogram 6 hourly for 7 days. Second line treatment: to give ciprofloxacin oral in adults 500 milligrams 12 hourly for 5 to 7 days. In children 12 to 18 years, if 250 to 750 milligrams 12 hourly. 1 month to 12 years, give 7.5 milligrams per kilogram 12 hourly. Dose doubled in severe cases. And neonates 7.5 milligrams per kilogram 12 hourly. Or you can give cefuroxime oral in adults 500 milligrams 12 hourly for 5 to 7 days. In children 12 to 18 years, give 250 milligrams 12 hourly, and those reduced to 125 milligrams 12 hourly in lower urinary tract infections. Or 2 to 12 years, 15 milligrams per kilogram 12 hourly, and a maximum of 250 milligrams 12 hourly. And 3 months to 2 years, 10 milligrams per kilogram 12 hourly, with a maximum of 125 milligrams 12 hourly. Also, you give mixed potassium citrate oral 10 milliliters 8 hourly if urine is acidic, a pH of 6 or below, and to reduce bladder pain and dysuria. So monitor potassium levels and avoid in hyperkalemia. Do not give with ciprofloxacin. Or you can give paracetamol oral 500 milligrams to 1 gram 6 to 8 hourly when required. For symptomatic cystitis and urinary tract infections in pregnancy, you give cefuroxime oral in adults 500 milligrams 12 hourly for 5 to 7 days, and then you add mixed potassium citrate oral 10 milliliters 8 hourly if urine is acidic, a pH of 6 or below, to reduce bladder pain and dysuria. So you monitor potassium levels and avoid in hyperkalemia, and do not give with ciprofloxacin. So referral criteria: refer all cases with which requires cystoscopy, in all cases of persistent hematuria, recurrent cystitis, or bacterial resistance to the specialist.